Most common surgery that we do as oculoplastic surgeons is blepharoplasty and ptosis surgery. And when we use the term blepharoplasty, it can involve the upper eyelid, or it can involve the lower eyelid, or both. And typically when we think about upper lid blepharoplasty, we usually are treating patients that have a fair amount of redundant eyelid skin that hangs onto their lashes, pushing their eyelashes downward, or skin that actually hangs in their visual field. And blepharoplasty surgery significantly improves a patient's superior vision or peripheral vision by removing that redundant skin. A blepharoplasty is performed in the operating room under sedation. An incision is made in the natural crease of the upper eyelid, and we remove the redundant skin and muscle. Dissolvable sutures are placed in the incision line following surgery, and the patient comes back 1 week following surgery for reevaluation. We do a specific workup in the clinic to determine if a patient is a candidate for insurance to cover their blepharoplasty, and that includes vision, visual field, a specific visual field test to determine if the peripheral vision and superior visual field is affected by the redundant eyelid skin. Ptosis is a droopy upper eyelid margin, meaning that where the eyelid and lashes meet the colored part of the eye, or the iris, is actually droopy. So the eyelid margin itself is hanging down into the patient's line of sight. And that's very different than dermatochalasis, or droopy upper eyelid skin that actually hangs over the lashes into the patient's line of sight. And it's different because it requires a different type of surgery. We often combine the two surgeries, so we'll remove redundant eyelid skin as well as tighten the muscle that helps elevate the eyelid, raising the eyelid margin out of the patient's line of sight and back into its normal anatomic position. We do that through a very similar incision that we do for a blepharoplasty through the natural crease of the upper eyelid, and it can be combined with a blepharoplasty very easily if necessary. We dissect through the eyelid to find the muscle that helps elevate the eyelid and tighten that muscle.